My name is Karen Williams. I'm a lecturer in advanced practice at the University of York. I'm also an advanced clinical practitioner working at York and Scarborough teaching hospitals. I therefore have experience of being a trainee, supporting other advanced practice trainees in practice and delivering an advanced practice master's degree programme. I've become increasingly interested in how we translate key knowledge, skills and behaviours and competency frameworks into clinical practice, and how we measure these things and make them useful as a tool to support trainee development. But as importantly, I'm also interested in how we support those working with trainees in practice in both informal and formal supervisor roles to feel that they have the knowledge, skills, tools and support to effectively supervise others. Advanced practice roles in UK healthcare are growing. One challenge associated with this growth is how to support these emerging roles, with practitioners from a widening variety of professional backgrounds working beyond traditional role boundaries and extending their scope of practice. We need more supervisors to help create, support, maintain and critically retain our advanced practice workforce for a sustainable future. We therefore need to grow confidence amongst our advanced practice workforce to grow supervisory capacity from within, as well as preparing supervisors from other groups, such as our medical colleagues. Considering ways of enabling effective supervision seems a crucial part of this, linking implicitly with the need for good governance to ensure patient safety and the delivery of the best possible care with the resources that we have. Along with my colleague, Dr. Sue Faulds, Reader in Advanced Practice from the University of York, I decided to look at the use of entrustable professional activities and their applicability for advanced practice. An entrustable professional activity, or EPA, is a unit of professional practice that can be fully entrusted to a trainee once he or she has demonstrated the necessary competence to execute this activity unsupervised. They usually require achievement of a combination of clearly defined competencies related to knowledge, skills and behaviours, which together provide the necessary evidence for a unit. Entrustable professional activities were first described by Tenkate in the early 2000s and have been widely adopted in healthcare education in the intervening years, mainly in medical education, but increasingly they have been adopted by other professional groups. Until now, entrustable professional activities have not been consistently adopted or researched within the UK advanced practice fields. Although there are examples of them appearing in some places, such as credential specifications, and they are used in the Royal College of Emergency Medicine Advanced Clinical Practitioner credentialing process. So therefore, we thought a scoping review would be appropriate to describe the current literature of the concept in the field and identify knowledge gaps. We followed the Joanna Briggs Institute protocol for scoping reviews and looked for studies and papers focusing on the use of entrustable professional activities within advanced practice healthcare roles. Because we found no UK advanced practice studies, we broadened our search to look elsewhere. The review questions were: what EPAs are currently used for advanced practice education and/or trainee supervision? Are any EPAs currently implemented in advanced practice education and/or trainee supervision? And is there any evidence regarding the effectiveness of EPAs in advanced practice education and/or trainee supervision? The findings were written as a narrative review, summarising the papers and studies and considering generalisability to UK roles. 9 papers were included in the review. As alluded to, no UK-based studies were identified. 3 key themes emerged. The first was that EPAs should not be viewed as a replacement or alternative to competency frameworks, but rather they can provide a way of connecting competency-based education and the completion of clinical tasks. In advanced practice, this may help bring together existing frameworks to create a cohesive model for developing confidence in practice. The second theme identified was around the role of the supervisor or assessor and entrustment as a concept. Of course, what some of the studies described was something we already know, which is that supervisors make informal trustment decisions all the time. In fact, most of us do this on a daily ad hoc basis, thinking about who can do what, depending on their experience, qualification, and skill. Entrustable professional activities offer a way of formalising this process and using it to enable supervisors and trainees to feel confident and clear about levels of practice, which could enable more effective work-based learning. And rather than increase the supervision burden, it may provide a way to reduce the need for direct supervision with clarity for all. The literature identified the importance of supervisor preparation for this to work. And in addition, some studies describe the importance of trainees' self-awareness and the ability to self-assess as integral to the process. Finally, there was a clear theme around the need for a strong connection between what a trainee was expected to do in the workplace and what they learnt as part of their educational preparation for the role. The review found that EPAs have the potential to strengthen the relationship between academic and clinical training, with an opportunity to, in effect, design curricula backwards from tasks a profession needs to perform to the knowledge, skills, and attributes needed. Clearly, we identified a lack of research in this area and no UK-specific studies, but the broad themes identified are likely to be relevant for UK advanced practice. Although reviewed with a critical eye, systematic critical appraisal was out of the scope of this review. Further research is recommended in this area, which could inform the decision-making of UK advanced practice leaders. It should also be mentioned that widespread inconsistency in role titles and definitions was found, and this could have led to some studies being inadvertently excluded because they were not identified by the search, despite our best efforts. Despite the limitations of this review, we hope it adds to the conversation about demonstrating competency in advanced practice. I guess, in summary, the key question a supervisor has to ask themselves is, can I trust you to do this? And in what circumstances? For example, can you do it if the patient is complex or it is an emergency, or only in certain circumstances with easy access to direct support? Entrustable professional activities offer a way of operationalising competencies in practice, using levels of trust to define clearly what a trainee should or shouldn't do. I hope you found this poster interesting. If you would like further information or a copy of the review, which has not yet been published, please contact me and I will be more than happy to help. Thank you.